This is Dr. Roger, family-friendly Beverly Hills orthopedic surgeon who treats sports injuries and joint pain. Welcome to the Weekend Warrior Show. I'm here to protect you from yourself and keep you out of the operating room. We had Paul online, and Paul is an amazingly well-rounded man with his Stress Hero and Stress Groups for Men. We have Janny with us right now, who has her goddess groups, which actually is the first. I didn't know you had a goddess group. I mean, men aren't allowed, right?
We have our women's group. That's why I was so curious to ask Paul about what you guys did in your men's group. But it sounds like you guys just go hiking and bond in caveman ways.
But you know what?
I don't know.
You want to know something? That's deep enough, because remember how men deal with stress. It's simple. They hide in their caves. So number one, Paul's right. They deal with it through camaraderie around women, around, alcohol, around anything that could distract them. So we use these exogenous distractions generally. And the way I say it is, I was recently on a 16-hour flight from Dubai, and I watched this show called The Vikings. And these are actually gave me a completely different viewpoint of the Vikings. I mean, they were incredibly well-rounded men, but they had the same problems, and they could not deal with stress. They drank, they killed people, and they raided. That's how they dealt with stress.
And so for those who are just turning in, this is your wonderful friend Paul that you can find him at thewellbeingmanager.com, right? He's a stress relief man, holistic health expert, that you're going to go to his classes, right?
Yeah, I definitely will. Here's the problem, actually, Jenny, to be honest with you. As silly as it sounds, I just had no time to go. And
Excuses.
I know, it's sad. I should have gone. And then also, on a more simpler basis, my mindset was, and I would never say it directly to Paul, was I don't have time to hike with a bunch of guys I don't know. And then sit around the campfire.
Are you serious?
I mean, it's
Come
sad,
on, it's all about community. I know you have a lot of friends, but, you can go out and do male bonding time. You just said, it's the way you reduce stress. And don't you suffer from back pain sometimes?
I do, and the next issue is, I want you to know, actually, Jenny, acknowledging early indicators like pain, swelling, especially in your back, and treating them can prevent you from having a lifetime of misery. And I will tell you something. I've got numerous people who I know around my circle who have back pain, and they go crazy. The first thing people do is they take medications. Why? Because the commercialism of the pharmaceutical companies with their signs, take this medication, take that medication, or they'll go to this hocus-pocus clinic that has the biggest billboard and the biggest ad saying, I can treat your back pain. The underlying issue is common sense. All of these issues do not need to have surgery, you don't need to have medications, you don't need to have even treatment. You need to break down what the initial issue is and see someone who's neutral, who's not going to put you through all of this, like a family doctor or a physical therapist.
Right, because so many people get addicted to pain pills. It is the number one addiction in the United States, and it's horrible because people take these Percocets, all kinds of pain pills to help relax their muscles and deal with their stress, but they're not getting to the root of the stress, the issue. They're just covering it up.
It's the classic Band-Aid. Everyone takes the Band-Aid, and when the Band-Aid doesn't work, you take more, and then you take a different medication. But I'll tell you something. I myself, 4 years ago, I was going crazy operating. I had a lot of personal stressors going on in terms of trying to make it happen, trying to make my practice go. It was tough, but I was that year I was doing about 700 cases a year, and at a certain point, I started having this horrendous numbness and tingling down my arms, and with the severe pain in my back. I could not sleep, and this had gone on for months. And I realized at a certain point, when I finally ended up coming home at, again, 11:30 at night, and my wife looked at me and said, "Where are you again? Why are you operating so late? Why are you doing all of this?" I just literally went through a mini breakdown where I realized didn't sleep for 2 months. The stress of the practice, people crying or, wanting me to operate, wanting me to treat, and I just put way too much on myself at that time that I had to step away. I had to step out of the situation, and I cleansed myself. The second I cleansed myself, and by doing so, by just taking a mini vacation. I went for 4 days with my wife, and I just went away from my practice. The second I did that, and I left the burden of stress onto someone else, someone who was covering for me, I felt like a new man. And you know what went away? Crazy. My back pain went away, and my numbness and tingling went away.
I know, but so how do you maintain that? Because you can't just, are you just take a vacation? All the time? You know what I mean? How did you incorporate balance in your life again so that it is consistent?
It's really
and you don't
tough,
have to wait
actually.
for the vacation.
It's tough, Jenny. In the sense, being a man, being a person in charge, being in the position I'm at, it's tough. So what I did is I had to force it on me, realizing that I have to take vacations. I have to decompress. Weekends are now my own. I don't share them with my patients. I don't share them with work. It's just me, myself, my family, and my close friends. And because of that, I've been able to stay on the pace I am. But I've known many surgeons who've had unnecessary surgeries, and I call it unnecessary because they didn't break down the crust of what happened to them.
Wow. Well, in the next segment, we can go get down and dirty with some very specific tips on how people can deal with stress and relieve back pain, because I know you don't want to see them in your operating room.
Oh, and you don't want to have unnecessary surgeries. And that's exactly what we'll talk about in the next segment. Next segment, we'll talk about how the commercial aspect of the business of even surgery is driving patients in the wrong direction, and how this whole system is messed up and how we are going to correct it. So stay tuned to our next segment.
And Dr. Raj, I'll share my personal story of how I threw out my back by dancing in a crazy drum circle.
And I will cry for you, big time. I'm going to cry and cry and cry.
Good.
Okay. Stay tuned for our next segment. Thank you.